In this video, I am going to talk about a class of anti-diabetic drug which is known as glitazones or thiazolidinediones. The short form is known as TZD and plays a role in regulating carbohydrate and lipid metabolism by acting on PPAR-gamma receptor, which is the nuclear receptor, and helps in correcting carbohydrate and lipid metabolism that is deranged in type 2 diabetes mellitus. Majority of the patients with diabetes have type 2 diabetes mellitus and is highly prevalent among obese individuals. And as we know that obesity is associated with insulin resistance, which causes derangement of carbohydrate and lipid metabolism. Numerous anti-diabetic drugs are available that help to lower the blood glucose level and reduce insulin resistance, and they act through various mechanisms. For example, sulfonylurea meglitinide class of drugs directly stimulate the pancreatic beta cells, causing secretion of insulin into the circulation, which in turn causes blood glucose lowering. Also, there is another class of anti-diabetic drug which is known as DPP-4 inhibitors and GLP-1 receptor agonists that also cause insulin secretion but through an indirect mechanism. Metformin is an older anti-diabetic drug that reduces blood glucose level by primarily decreasing the hepatic production of glucose. It also reduces insulin resistance and helps in normalizing the blood glucose level. A newer class of anti-diabetic drug which is known as SGLT2 inhibitors that act on the kidney tubules and reduce the absorption of glucose and cause excretion of glucose in urine. So these drugs act on the kidney tubules, decreasing the reabsorption of glucose and causing excretion of glucose in urine. Lastly, there is another class of anti-diabetic drug which is known as thiazolidinediones. The short form is TZD, known as glitazones, that specifically reduces the insulin resistance in the target organs such as liver, muscle, adipose tissue, and helps to normalize the blood glucose level, correct carbohydrate and lipid metabolism. These drugs act through PPAR-gamma receptor, which is a nuclear receptor, and helps in regulating carbohydrate and lipid metabolism and is very useful in the treatment of type 2 diabetes mellitus. Before discussing the role of PPAR-gamma receptor in regulating carbohydrate and lipid metabolism, let's first understand the detrimental effects of insulin resistance and how lowering of insulin resistance has a beneficial effect on carbohydrate and lipid metabolism and hence useful in type 2 diabetes mellitus. As we can see in this figure, insulin is secreted from the pancreatic beta cells, but the tissues fail to respond to the actions of insulin. This is because of decreased affinity of insulin for the receptor, or the insulin signaling is defective, or there is decreased number of insulin receptors that are expressed in the target organs, thus decreasing the responsiveness to insulin. So let us see what are the effects of insulin resistance on various target organs. In the skeletal muscle, because of insulin resistance, there is decreased uptake and utilization of glucose by the skeletal muscle for metabolism, and this increases the blood glucose levels in the circulation. As we can see in this figure, in the liver of a healthy individual, when the blood glucose level rises, the insulin signaling is activated and glucagon is reduced in order to decrease the blood glucose level, in order to normalize the blood glucose level. But when there is insulin resistance, which is common in type 2 diabetes mellitus and in obesity, there is derangement of carbohydrate metabolism. So because of insulin resistance, there is increased glucose output, and this causes further increase in the blood glucose level. Now what happens to the pancreatic beta cells? The pancreatic beta cells, in order to overcome the insulin resistance and to lower the blood glucose level, secretes insulin into the circulation, and this causes compensatory hyperinsulinemia, a condition where there is high circulating levels of insulin in order to normalize the blood glucose level. But because of continuous action on the pancreatic beta cells over a period of time, there is apoptosis, injury to the pancreatic beta cells, and this causes dysfunction of the secretory beta cells, causing a decline in insulin secretion over a period of time. So Secondly, insulin resistance causes dysregulation of lipid metabolism. As we know that adipose tissue is the primary site for triglyceride storage, and also in insulin resistance there is high circulating levels of insulin, and insulin has the property of lipogenesis, a process of creating fats and triglyceride that is stored in the adipose tissue. Also, because of insulin resistance, there is defect in fatty acid metabolism, and because the metabolism is defective, there is excessive production of free fatty acids, and these fatty acids pour into the circulation, enter into the circulation, increasing the circulation of free fatty acids. These excessive free fatty acids gets deposited around the visceral organs such as the liver, the skeletal muscle, the pancreatic cells, the blood vessels, and this further reduces the insulin signaling and increases the insulin resistance and further causing worsening of the condition. In this way, insulin resistance causes ectopic deposition of fat in various visceral organs, and this increases the risk of cardiovascular events. Thirdly, insulin resistance increases inflammation by causing release of inflammatory mediators such as interleukin-1, 6, tumor necrosis factor alpha that increases inflammation in the liver, fibrosis in the liver. Fourth, insulin resistance increases the oxidative stress by increasing the formation of free radicals in the circulation, and these free radicals causes damage to the endothelium, causing endothelial dysfunction and decreasing the vasodilatation because of decreased release of nitric oxide and endothelium derived relaxing factor. So this decreases the vasodilatation, increases the oxidative stress and inflammation. Oxidative stress increases the risk of cardiovascular events and increases the progression of atherosclerosis. So till now we have seen how insulin resistance causes dysregulation of carbohydrate and lipid metabolism. Now let's see how thiazolidinediones or glutazones act through PPAR-gamma receptor and normalize carbohydrate and lipid metabolism and is beneficial in type 2 diabetes mellitus. So thiazolidinediones or glutazones are selective agonists on PPAR-gamma receptor that is expressed in the skeletal muscle, liver and adipose tissue. Firstly, in the skeletal muscle, these drugs act on the PPAR-gamma receptor, which increases the insulin sensitivity, which increases the insulin signaling in the skeletal muscle. Increased insulin signaling causes recruitment of the GLUT4 transporters to the membrane of the skeletal muscle, and this causes increased glucose uptake into the skeletal muscle and utilization by oxidation. So PPAR-gamma activation enhances the glucose sensitivity in the skeletal muscle, causing increased glucose uptake and decreasing the blood glucose levels. So it helps to normalize the blood glucose level by activating the PPAR-gamma receptors in the skeletal muscle. Secondly, PPAR-gamma receptor is also expressed in the adipose tissue, the primary site for triglyceride storage. So it helps to increase the uptake of free fatty acids from the circulation into the adipose tissue. So increase entry of free fatty acids into the adipose tissue and its conversion to triglyceride and its storage in adipose tissue, which is the primary site for lipid storage. So the free fatty acids in the circulation decreases, and this decreases the lipid deposition in the liver, the skeletal muscle and the blood vessels. PPAR-gamma activation in the liver decreases the uptake of free fatty acids from the circulation into the liver. Secondly, it also increases the free fatty acid oxidation. So the fatty acids are oxidized and the triglyceride accumulation or synthesis is decreased in the liver. So lipid synthesis in the liver is decreased and there is increased free fatty acid oxidation in the liver. Because free fatty acids are reduced in the liver, the VLDL secretion from the liver is reduced. So in the circulation, the VLDL is less, the LDL is decreased and the HDL lipoprotein is increased. So this reduces the incidence of cardiovascular events by decreasing LDL, VLDL and enhancing the HDL levels in the circulation. Lastly, PPAR-gamma receptor activation in the inflammatory cells decreases the release of inflammatory mediators, decreases oxidative stress, decreases damage to the endothelium, reduces the cellular proliferation, the recruitment of macrophages is reduced, and this decreases the progression of atherosclerotic diseases. So in this way, through the activation of PPAR-gamma receptors, the cardiovascular events are reduced. So we have discussed the effects of thiazolidinediones acting through PPAR-gamma receptors, the damaging effects of insulin resistance, and how thiazolidinediones, by reducing insulin resistance, have a beneficial effect in type 2 diabetes mellitus. In my next lecture, I will talk about the adverse effects of thiazolidinediones. So thank you for watching. If you find this video useful, please like and subscribe to this channel.